Hi, I'm Dr. Lazar and I'm coming to you from my home office. So excited about our announcement to open full hours on May 1st. Now, we've taken a lot of precautions and I'm going to list some of those here so that you know that you're completely safe and we're doing our part to keep you, your friends, your family out of the hospital system, which is where COVID is still present, and we want to lighten the burden there. So we want to invest health into you and your family. We want to do it safely, of course, and we want to reduce the impact of our hospital system having to process more people. So we're going to do our part. We need your help with that. So here are some of the things that we've instituted. We are screening visits and asking the following 4 questions. Have you had a sore throat or a cough in the last 48 hours? Question number 2 is, have you had a fever of greater than 100 in the last 48 hours? Question number 3, have you been out of the state or country? A little bit redundant there, but I guess if you've been out of the state, you've been out of the country. But in the last 14 days, most people have not at this point. And then have you been around anybody who's tested positive for COVID in the last 14 days? If you answer yes to any of those, we'll ask you to not come in until you've crossed that 14-day mark. We're not that worried about it, but we do want to keep everybody safe. Some other things we have in place are we are doing a parking lot to suite offer for those of you, so we don't have too many people in the office at a time. That means when you get to the parking lot, you can call or text the office and we will let you know when your suite's ready. You can come right in, go to your suite. A couple things that we're doing internally, we've restructured the office so nobody is within 6 feet of each other. We have the markings on the floor, we have the chairs spaced 6 feet apart, and we're doing our part to keep you safe that way. Everybody on the team is masked, and we'd ask you to wear masks into the office. We also, any provider, any doctor is gloved, and we wash hands and replace gloves, of course, between each visit. We also wipe down each room and any contact surface, so table, headpiece, handlebars that you grab onto to get on the platforms, door handles, anything that is touched, we wipe down after each visit. So we're telling you that, number one, we want you to know that you're safe. Number two, we want you to know that we're doing our part to allow for you to get the care you need but not be unnecessarily exposed to things. Keep in mind this care boosts your immune system, so this is hugely important, and I can say that we don't have a single patient that's gotten more than 2 adjustments test positive for COVID. We did unfortunately have 1 patient who tested positive, only received 2 adjustments from us before that happened, but is fully recovered and everything's good there. So safe to say that we're doing our part boosting your immune system, and now is a great time to get your friends and family checked so that they can invest in their health. We're keeping numbers in the office limited, so keep that in mind. Wait times are a little bit higher because we have these measures we're taking in between each visit. And we're asking that guests do not join you for your visit. So the only people in the office can be patients that we're seeing, and or if you're a minor, of course, we need an adult present there. So those are the things we've done. I am so excited, and my team is so excited to welcome you back. We are going to have the best May ever. We're going to have an awesome time, and any questions or concerns about your accounts, let us know. If you're having a hardship or things are going on, we still want you to stay current with your care. We will work with you. A couple things we've done financially are people that have asked, we've pushed your payment to the end. We can't do that automatically. It's something that has to be requested because it's a manual process. We also have waived any decline fees, so if your account is on a monthly payment and there's been a decline, we've completely waived those, and we're doing that. We're extending that through the month of May, and so we just want to help you. We want to be part of your ongoing family. We're very proud of you for the measures that you've taken to keep your family safe and healthy, and we are excited to be back together as the Lazar Spinal Care family and get everybody taken care of. Can't wait to see you. Thanks so much, and we'll see you real soon. Have your best day ever.